Time for another edition of Wellness Wednesday with Dr. Bradley Meyer of the Okoboji Wellness Clinic. Good morning, Dr. Meyer.
Hey, good morning, Dave. Brr, chilly. It's like it would be a good day to jump. I looked at Westlake this morning, and the waves were rolling in, coming in, crashing in cold and hard, and I said, cold plunge, anybody?
Oh.
I didn't do it today yet, so maybe when I get off of work tonight.
All right. Well, today we're going to talk about how do we do things, how do we get started? You know, I thought about that a little bit, and like this morning for the first time this year, I grabbed my winter coat because it's 28 and windy, and so I thought I needed a winter coat. Well, we need to decide sometimes when we get up and we're not feeling the greatest or the days keep clicking by one, we don't feel that great. When do we give Dr. Meyer a call? Do we wait for something catastrophic to happen, or how do we get to feeling better?
Yeah, great question. And I'm going to share a little bit of my own personal struggle and maybe how everybody can relate to that. You know, this summer we talked a bit about how I developed some significant joint pain after eating some gluten and dairy, and this led to some more discovery on my own health journey in decreasing inflammation, fatigue, brain fog, those kinds of things. So I talk to my guests every day about these things, and I'm walking through it myself. But you know, a missing piece for me or a struggle my whole life, and this was even when I was in the Air Force, and, you know, a lot of times it was required every morning, so that was a good thing, but moving the body is something that I probably don't emphasize enough for my guests, and I'm going to start emphasizing it more. And it's maybe because I haven't personally been able to reach that, attain that next level for myself. So, you know, that's always been out there in my busy schedule, you know, seeing folks every day, and the calendar fills up, the hours fill up in a day, and finishing up on notes on the computer and figuring out plans for how to get people feeling better again. The hours, they go by so fast. But I had an invitation this week and actually this weekend to join a group at Athletic Republic. And I went to high school with Levi Marquardt, and he's an incredible kettlebeller. And so there's a group of guys that get going every Tuesday, Thursday, and Sunday. And one of the members of that group invited me to join, and so I had molded over for so long getting over there to the gym, and I kudos to myself because I've gotten into the routine of walking the dogs this fall. That's a step, and so that is the key for everyone as we walk into this. Is I love the movie What About Bob, and he talks about baby steps in there, and because we're not gonna achieve this huge goal of the mountaintop on day one in most cases. But what is achievable for you, and what's achievable for you in getting you to where you want to be, you know, physically, mentally, and a big piece is that movement. So when you move the body, of course, you're increasing oxygen saturation, blood flow to your tissue, to your brain, your mitochondria that we've talked about. Everything is going to work better for you. And what we're trying to accomplish at the Okoboji Wellness Clinic is going to work better for you. And so the beautiful thing in talking about starting with just simple goals, you can look into something called HIIT training, this high-intensity training, and this is kind of what I'm doing with Levi and this group of guys. It's a 15-minute, 20-minute morning routine where it's high intensity for, you know, a few 20, 30 seconds and then rest 20, 30 seconds, that kind of thing. Getting that heart rate up, which is so good for your body, good for your mitochondria, which is huge for inflammation, for all the things that we're trying to accomplish in getting ourselves feeling better, the neurotransmitters, all those, the things that make us feel good, the dopamine, those kinds of things. But it doesn't take 2 hours a day at the gym. Now, eventually some folks may want to get to that point, probably not in my future, but I tell you what, I'm very thankful for this gentleman that he asked me, and I'd been asked a couple times before, and this was the third time, and I felt it was time. I felt, because with the journey on my own health this last summer, I've started to adjust my own lifestyle, my own nutrition, taking the proper supplements, doing the things that we do in our clinic that optimize healing and wellness through the different modalities and treatments. But just want to encourage everybody and ask you that question: what's it going to take for you to get started? And I get so many folks that come into the clinic that doing something like a high intensity workout, that might not be it for them, and because folks are so inflamed and so debilitated, their gait and balance is off. So many times we're working with them for the next 6 to 12 months on their inflammation, hyperbaric therapy, neurofeedback, red light, brain gauge, all the different things that we're doing, working nutritionally, getting on the right supplements, finding out what's inflaming us. Get going on that path, and then once you start feeling better that way, then you start thinking about that next step. But it doesn't mean that you can't, even in the process of getting going in our clinic, with some movement. And that movement might just mean I'm going to walk around the house, or I'm going to walk in my living room, and or I'm going to walk in the mall in the wintertime. Whatever it may be. Get out there and move a little bit, and inertia leads to inertia. Lack of movement just compounds lack of movement. So once you get the body rolling and moving, it starts to crave it. And once you start to feel better, you're more motivated to keep it going. And so that's a little bit of my story on the challenge, and I'll keep you up to date as I move along in this journey. So I encourage everybody, utilize those resources in your communities, the gyms, there's a lot of great folks out there that really want to help you get well, a lot of great chiropractors, folks doing acupuncture, massage. We have so many great folks in the communities up here in Northwest Iowa that are on this mission of health and wellness, and I want to encourage everybody to utilize those services, because that's where we're at right now. We're not accepting the same old, I have to feel bad forever. This is part of aging. No, not anymore. It's a new day, and we want to feel better, and we're going to make that our mission, make it your mission, and it's my wish. If it's my wish for myself, like I said last week, it's my wish for you.
One of the greatest stories you told very early when we began this journey with the Okoboji Wellness Clinic was a lady had come into you. She had seen several doctors. I think she had a foot drag issue. She came in to see you, and they said, this is just going to be the way it's going to be. And she refused to accept that diagnosis, that this was going to be how she was going to have to live the rest of her life, if I'm recalling this correctly.
Correct.
And pretty much put a challenge to you, and it's like, all right, I've been to everywhere. Can you help me or not? Because I'm not living this way.
Yes, and she fixed herself.
Yeah,
she did. We had some suggestions to help her body heal and some different approaches, but she did that. That was her.
Yeah.
And that's what it is. It's putting it into your own mind and creating in your mind that picture, and then moving towards that goal. Because a lot of things that I didn't think were possible years ago, I think are possible now. Well, I love the mantra, anything is possible.
So just think of where we have come from. And honestly, I'm looking back at this COVID thing and really counting it as from a medical situation as a huge blessing, because I think it made the medical community pretty much reevaluate everything.
Amen. And yesterday I was on the phone with an oncologist that travels through one of the local hospitals, and a mutual guest who is working through some difficult times, and she shared with me that he had stated that there needs to be a bridge that's created. There needs to be a coming together of the conventional and holistic models. And that used to exist back in the 1920s and 30s. In the conventional model, there was a lot more holistic medicine. And that changed. And so I'm starting to, this is the movement that's happening. And when you hear, I talked to him on the phone yesterday in follow-up and was very encouraged. And that he was very open to some of the different approaches and using those things together. So yes, and yes.
Yeah. All right. So we want people to feel better, especially as we approach the holidays. Lots to be thankful for as we head to Thanksgiving, but we want people to live every day, not just survive the day. How do they get a hold of you? How do they come see you?
Yeah, and again, I'll just challenge everybody too, and it's don't wait. So it's, for me, I wasn't waiting until January 1st in the new year to get going. But if that's your time, that's better than not. So, you owe it to yourself to feel better. That's the Creator created us in with perfection in mind, and I believe He wants us to feel well. So, give us a call. Yeah, 712-339-6024. And we're at 3305 Berquist Avenue in Spirit Lake, just off Highway 71. Of course, I do the discovery calls for 15 minutes to get a little bit of history from you. That's all complimentary to determine what your path forward might look like at our integrative wellness clinic, and hopefully give you some reassurance and hope and an idea of what where the path may lead you.
Very good. Dr. Meyer, it's always a pleasure. Have a great day, and we'll chat with you again next Wednesday.
All right. Be well, everybody. God bless.
Thank you, Doctor. Dr. Bradley Meyer at the Okoboji Wellness Clinic. You can visit them online at okobojiwellnessclinic.com.